My name is Ronisha Roberson. I am one of the healthcare facilitators. It's myself along with my partner, Lilia Huato, and we service the UC San Diego faculty, staff, retirees, and survivors, and also their dependents with healthcare related issues. So, like I said, HCF, our team assists faculty, staff, retirees, survivors, and their dependents with issues such as helping with billing problems, providing detailed comparisons to benefit options, intervening on your behalf with the health plans, and explaining Medicare coordination of benefits with the UC-sponsored medical plans. If you have questions, we're going to ask you to go ahead and throw those in the chat. However, there will be time for a live question and answer at the end of the presentation. And I know that Medicare can bring up a lot of questions. So hopefully I've done a good enough job with this presentation and most of your questions will be answered as we progress through the presentation. But again, you can use the chat for any additional questions you may have. Now we're going to go into Medicare and the basics of Medicare. So what is Medicare? Medicare is a federal program that provides health care coverage for individuals who meet the following criteria: 65 or older, with 10 years of work experience or 40 employment credits. If you're under the age of 65, you may qualify if you're disabled as determined by Social Security, if you're already receiving Social Security income for at least 24 months, or if you have end-stage renal disease. So what happens if none of the things that I just talked about that you qualify for? You may be eligible in a different manner. If you're not eligible for Medicare under your own employment record, you may qualify in one of these instances. You may qualify if you are currently married and have been married for at least one year. And then when your spouse turns 62, you can qualify under your spouse's work record. Or if you had a previous spouse and you were married a minimum of 10 years and the spouse was Medicare eligible for Social Security at 62, you may qualify under your previous spouse's record. If you're not eligible for Medicare, you will still need to apply and provide proof to UC, and then that way you'll remain covered under your non-Medicare plan, but we'll discuss that a little bit later as well. Now let's review the parts of Medicare. Medicare is made up of 4 parts. Part A covers your hospital, inpatient care, skilled nursing and hospice care, your home health services, and it's usually premium free as long as you, your spouse, or your ex-spouse has worked full-time for a minimum of 10 years and paid Social Security taxes. If you qualify through your spouse or ex-spouse, you need to have been married at least 10 years. Part B is your medical insurance. You pay a monthly Part B premium directly to Social Security, which is automatically directly to Social Security, or it's automatically deducted from your Social Security income. Part C is not necessarily a component of Medicare, but rather it's a type of Medicare health plan, also known as Medicare Advantage plans. Medicare Advantage plans are health plans offered by Medicare, approved private companies that contract with Medicare to provide you with all parts of Medicare, A and B. The UC offers Part C plan designs, which we will cover in more detail later in this presentation. And then the last part of Medicare is Part D. And Part D is your outpatient prescription drug benefit. Most UC retirees do not pay an extra premium for Part D unless they have a higher income. The UC coordinates with Medicare with your UC Medicare plan. Now let's talk a little bit more about Part D. Enrolling in one of UC-sponsored Medicare plans, it's subsidized and often lowers medical plan premiums. UC plans include outpatient prescription drug benefits or Part D coverage. The prescription drug coverage of UC medical plans is equivalent to or better than Part D original Medicare plans. and is considered credible coverage. The formulary often differs from your non-Medicare plan to a Medicare plan, so please remember to review your evidence of coverage booklets for more detailed information. Enrollment in any other Part D plan may result in loss of your UC prescription drug coverage. Retirees with Medicare must complete and enroll via a form, and we will discuss those forms later. Those are the UBIN forms I'm sure you've heard a whole lot about. Most plans with Medicare prescription drug coverage have a coverage gap that you may have heard of called a donut hole. What a donut hole means is that after you and your drug plan have spent a certain amount of money for covered drugs, you must pay the cost out of pocket for your prescription drugs up to a yearly max. UC does not have those clauses included in any of our plans. Now again, Part D duplicate coverage is not allowed, and enrollment in another Part D plan will result in your loss of coverage. The two exceptions to this rule are the UC Medicare PPO without prescription drug plan. You will have to purchase a separate prescription drug plan through Medicare. And then those with triple coverage through UC Medicare, CalPERS, TRICARE for life, or any other Medicare, Medi-Cal plan. Now let's talk about Medicare premiums. So these Medicare premiums are the premiums that you would pay straight to Medicare and does not include any of your UC plan premiums. There was an increase this year in 2024 from last year of $9.80, making the baseline premium for 2024 $174.70. Medicare premiums are based on income from 2 years prior, so your 2024 rates are based on your 2022 income. Now, most people qualify for Medicare, receive Part A premium free if they've paid into FICA taxes for 10 years and have those 40 employment credits. If you have less than 40 employment credits, you will pay a premium. For those who have 30 to 39 credits, the premium is $278 per month. And for those to 0 to 29 credits, there is a premium of $505 per month. Now, Medicare Part B will always have a premium. The higher the income, the higher the premium. Again, the base rate for Medicare Part B for someone making $103,000 or less as an individual, or $206,000 or less for a joint filing, the premium is $174.70 for Part B and 0 for Part D. As you see from the chart, the premiums increase as the income increases. Also, as with Part A, most have a premium-free Part D, unless they are in a higher income bracket. And again, I want to make sure we note here that you pay these premiums in addition to any Medicare medical premium you may have with UC. It doesn't matter if you're enrolled in a UC plan or an original commercial Medicare plan that you see on the TV with Aetna or any of those other companies. You will always pay two premiums. You will pay that Medicare Part B premium directly to Social Security, CMS, and Medicare, and then you'll pay the plan premiums, which come out of your pension check, and we'll discuss that a little bit more later on in this presentation. There's a few ways to enroll in Medicare. The first is an automatic enrollment. If you are currently collecting Social Security benefits and you're just reaching the age of 65, Medicare or Social Security will automatically enroll you in Part A and Part B. If you're also under 65 and you're entitled to SSD, which is Social Security disability benefits, you will also be automatically enrolled. You will receive your Medicare card in the mail, indicating automatically enrollment in Parts A and B. You do have the option, if you're still working and maybe you're working somewhere else, to decline Part B and return Social Security card, or return the card to Social Security. And your coverage will begin the first day of the month, unless your birthday is the first of the month, And in those cases, your first effective date will start the first day of the preceding month. Now, outside of being automatically enrolled, there are 3 enrollment periods. The first is the initial enrollment period. And this is when you first become eligible at the age of 65. That's a 7-month period, and it will start 3 months before your 65th birthday, your birthday month, and 3 months after. The second is the special enrollment period, which is usually the period those who are still working will enroll. That is an 8-month period, and it starts the first day of the month your employee coverage begins, or employee coverage ends, excuse me. And for the third enrollment, that is the general enrollment period, which is anyone who missed the other 2 enrollment periods. If you enroll during the general enrollment period, it is only during January 1st to March 31st each year, and the coverage starts July 1st of that year. Again, if you're already collecting Social Security, you'll be automatically enrolled in Medicare Part A and Part B 90 days before your 65th birthday. Social Security will send you your card reflecting this, and premiums will be deducted from your Social Security income. If you're not collecting Social Security, you should begin applying 90 days or 3 months before your 65th birthday. You may apply in person, over the phone, or walk into your local Social Security office. If you have been denied Medicare, request a denial letter and make sure UC is notified. You will then stay on one of the non-Medicare plans. If you choose to enroll using the online option, this is the landing page for the Social Security website, www.ssa.gov. This is the page you will go to when you want to sign up for Medicare. You can also check your accounts to see how many work credits you have. You can check your application status, and you can also get replacement Medicare cards from this website as well. If you have specific questions, these are the Medicare experts besides myself and Lilia: Social Security Administration, CMS, or the Centers for Medicare and Medicaid Services, and then you have the HICAP, or the Health Insurance Counseling and Advocacy Program. So Social Security are the experts on enrollment, eligibility, premiums, and ID card replacement. CMS is the experts for service claims coverage and understanding your benefits. And CMS or HICAP are the experts in helping people understand Medicare and resolving Medicare issues. What are UC's requirements for Medicare? So UC requires that all retirees over the age of 65 and their dependents enroll in Medicare. If you're eligible for premium-free Part A, you must enroll in Medicare Part B. By doing this, it allows UC to offset the cost of insurance and pass those retiree benefits and savings down to you. In order to enroll in the UC-sponsored Medicare plan, you must enroll in both parts of Medicare A and B, and your card must reflect both with effective dates. If you fail to comply with this, there are some penalties that we will discuss a little bit later, and it could lead to permanent loss of UC-sponsored medical coverage. 2 exceptions to this rule are those who retired prior to July 1991, because most of those folks did not pay into Social Security, and then those retirees who live outside the United States where Medicare is not required. However, if you move back to the U.S., UC will require you to enroll in Medicare, and then you may have a late enrollment penalty assessed at that time. You can obtain all the information you need in the UC Medicare fact sheet booklet that you can see here. It is located on UCNet, and you can download that by either scanning the QR code here, or we'll also give you the links at the end of the presentation. Okay, so what happens for all you folks that are already retired and turning 65. If you turn 65 after retirement, the RASC will send you an aging in packet approximately 90 days before your 65th birthday. And this will include information and instructions on how to apply for Medicare, any forms that you'll need, and what to do. Once you're enrolled and have your Medicare ID card, you'll need to complete the appropriate UBIN form to assign your prescription drug coverage to the UC-sponsored Medicare plan and submit that to the RASC. So if you see here on the chart, you'll see the non-Medicare plans on the left. If you're in one of those plans, the plan on the right will be the Medicare plan that you will need to enroll in, and we'll give you those UBIN form numbers a little bit later. So here's an example of a UC retiree that's aging into Medicare. So this person's aging into Medicare in the month of April. So in January, UC will send you a notice to enroll in Medicare Part A and Part B. It'll explain your deadlines, it'll explain what forms need to be completed and submitted, and it'll explain when your start date will be. Your start date will be April 1st of that year, whatever year it is that you turn 65. Doesn't matter if you're April 15th, April 25th, or April 1st, or April 2nd, I should say. Your start date will be April 1st. Now you have 3 months. You have the month of January, February, and March to complete those forms and complete and submit everything over to the RASC. And then April, you can become effective. Now, if you go through those 4 months and still do not apply or submit your documentation, UC will assess a penalty for 3 months of $419.60. So the month of May, June, and July, you'll be assessed that penalty for not enrolling in a timely manner. And again, if you're not eligible for Medicare, request that denial letter and submit it. That way you won't get any penalties and you'll remain on a non-Medicare plan. Now, UC offers a variety of Medicare plans. We have Advantage plans, supplement plans. We're going to discuss the health savings plan, and then we'll discuss via benefits, which is for those that live outside the state of California. Now, you may receive offers to enroll in non-UC Medicare plans, even from insurance carriers that work with UC like Kaiser or United Healthcare. These offers are individual Medicare plans which do not cover all the benefits offered by the UC group plan. So consider carefully before making any plan changes or suspending your coverage with UC. You may only be enrolled in one Medicare plan at any one time. If you have any questions, you can contact either myself, Lilia, or the RASC. Please mute yourself. I hear somebody talking. Okay. So one of the most common questions received at the time of retirement or after is what is my medical plan options if I move out of state? So let's start with California. We're going to talk about what options you have if you stay within the state of California. There are Anthem Blue Cross plans, so the PPO plans are UC Medicare PPO. You have them with prescription drugs and without. And then you have the high option PPO plan. You have Kaiser Senior Advantage through Kaiser Permanente. And then you have United Healthcare UC Medicare Choice PPO plan. Outside the state of California, you have the PPO options, UC Medicare PPO with and without prescription drugs. And if all your members of your family are enrolled in Medicare, you have the via benefits option. And we'll talk about that again a little later. For those that live abroad, you do not have any Medicare options. You will have to choose either UC Care or CORE because Medicare does not work outside of the U.S. I wanted to make sure I noted here that split families or retirees, we're talking about that next, sorry. So split families. So we have retirees and some family members that are eligible for Medicare and some that are not. So you are considered a split or a mixed Medicare family. Those who are enrolled in Medicare will enroll in the Medicare plan that is the partner plan for the non-Medicare plans. The non-Medicare plan members will enroll or stay enrolled in the plans on the left, and the Medicare members will enroll in the plans on the right. Wanted to make sure we emphasize here that the retiree's plan drives the dependent plan. For example, if the retiree is non-Medicare and enrolled in UC Blue and Gold, their spouse that may be Medicare eligible will have to enroll in the UC Medicare Choice PPO. And remember also, if you're enrolled in the health savings plan, you need to choose another plan. And we'll talk about the health savings plan in a minute. First, we're going to talk about these Advantage plans. So we have two Advantage plans. Under a Medicare Advantage plan design, you assign your Medicare to a Medicare-approved insurance carrier that must follow strict rules set forth by Medicare. Whenever you visit your provider will bill the insurance carrier directly. Under this plan design, you do not have a deductible and you pay co-payments for services. UC currently offers two Medicare Advantage plans. We have the Kaiser Senior Advantage plan administered by Kaiser Permanente, and it is an HMO Medicare Advantage plan design. And this means you must stay within the Kaiser network, and referrals are required to see a specialist. And then we have the UC Medicare PPO, Medicare Choice PPO plan administered by United Healthcare. And this is also a Medicare Advantage plan, but it is a PPO plan design. This means you have the flexibility to see both United Healthcare and Medicare providers, and you do not need a referral to see a specialist. The provider must accept Medicare and the United Healthcare Advantage PPO plan. We want to also emphasize that Medicare cannot be used separately from the Medicare Advantage plan. So the coverage will change going from the Medicare, non-Medicare to the Medicare plans. Not much, but it does differ in a few different ways. The inpatient stays the same at $250, and then their Medicare emergency services goes down to $65 once you go into Medicare, but they both are waived if admitted. Prescription drug coverage remains the same. Your co-payments will remain the same. However, the insulin administration devices and generic drugs will now be a zero co-payment. That's as of 2024. And then your brand name and specialty drugs are also at a zero copayment for insulin. They used to be a $10 copayment. Wellness resources remain the same. Eyeglasses, while it's not covered under the Kaiser Permanente non-Medicare plan, once you go into the Advantage plan, you do have a $150 allowance for eyeglasses. The lenses, the contact lenses, you have frames also, and that's every 2 years or 24 months. Your behavior health does differ. There is no Optum coverage under the Kaiser Senior Advantage plan. Hearing aids, while there's only a $1,000 allowance for non-Medicare, once you go into Medicare, it's a $2,500 allowance per ear. Acupuncture and chiropractic care, it is a combined service with non-Medicare, and under Advantage, it's two separate services. And so you have two under acupuncture and chiropractic care. And then your annual out-of-pocket max, while it remains the same for medical per member, prescription drugs is $6,550. Both plans, you can see that you can still go to the Target Minute Clinic with a $0 preventative care services, and your non-emergent services will be a $20 copayment. Now with Blue and Gold and UC Medicare Choice, while they are administered by two different vendors, one is administered by HealthNet, the other one is the partner plan is administered by United Healthcare. UC Medicare Choice is United Healthcare. We still compared them. Outpatient surgery stays the same. Inpatient mental health stays the same. Your emergency visits are $65, and that is waived if admitted as well. Prescription drug remains the same. Your office behavior visits are the same, $20. It used to be that the providers could not submit claims directly to United Healthcare, and this year they are offering that service. Then you have your hearing aids. While under UC Blue and Gold, the plan only would pay 50% up to $2,000. Under UC Medicare Choice, you have a $2,000 funds. You have $2,000 worth of funds every 3 years, and there is no quantity limit. Again, you have each benefit for chiropractic and acupuncture. It's not a separate benefit, and it's 24 visits per year for each benefit. For telehealth, you do have the same services. Actually, you don't. Sorry, you have Teledoc under UC Blue and Gold, and then you have Amwell, Doctor on Demand, and Teledoc under UC Medicare Choice. Under UC Medicare Choice, they do have an expanded gym network with Renew Active. They also have post-discharge meals and transportation after you get out of the hospital. And they do offer the personal emergency response system by Lifeline. So that Life Alert bracelets, in case you fall, those are given out to members for free. And then the medical groups, while you do have medical groups under UC Blue and Gold because it is an HMO, for UC Medicare Choice, it is open access. You can choose any medical provider in or out of network if they accept the plan and have not opted out or been excluded from Medicare, and pay the same base co-payments. Your out-of-pocket maximum for Choice is $1,500 medical and $2,000 prescription drugs per member. And then remember, for the PPO plans, you have worldwide coverage for urgent care services, and can access any retail walk-in clinic or urgent care facility. Supplement plans, or the PPO plans. UC's PPO supplement plan is UC Medicare PPO with or without prescription drugs. If you're currently enrolled in UC Care or UC or Core, your Medicare plan will be UC Medicare PPO. With the supplemental plans, Medicare is primary and Anthem Blue Cross is secondary. Your supplement plan pays 80% after Medicare for most services, and you pay deductibles and co-insurance. You must receive care from Medicare certified providers, making sure that you ask your current or possible providers if they are currently accepting new Medicare patients. While High Option is also one of our PPO supplement plans, it's only available during open enrollment, and all members of your family must be enrolled in Medicare at the time of enrollment. Now, here's a brief summary of the benefits covered under the UC Medicare PPO plan. You have, of course, Medicare's primary. Anthem Blue Cross is your supplement or secondary payer. You have a $100 deductible. Your inpatient services, you will not pay anything until your 61st day. And that day you will pay $70.40. And then after 90 days, you'll pay 20% of the total balance. Your physician behavior health and chiropractic visits are 20% or 20% plus the remaining balance, if not a contracted provider. If you want better coverage, we recommend that you use Medicare providers, or you're going to pay the non-Medicare provider the 20%. Prescription drug coverage is through Navitus Health Solutions, and you can see the co-payments there. Eyeglasses are not covered under the Medicare PPO plans, so we ask you to consider staying enrolled or enrolling in VSP. Hearing aid services and acupuncture are not covered services by Medicare, so you are subject to the 80-20 rule. Anthem will pay 80, you will pay 20%. For acupuncture, that's up to 24 visits per calendar year. Your annual out-of-pocket max for this plan is $1,500 medical, $7,400 for prescription drugs per member. And then you have the telehealth, telemedicine, psychology. You have live health online, and that's available 24/7 for doctors or psychiatrist visits, and that is a $20 copay. This plan has worldwide coverage for up to 6 months if you're outside of the US. If you stay outside for longer than 6 months, you should consider enrolling in UC Care or Core. High option is about the same as the last UC Medicare PPO. It is a supplement plan. Again, this plan is only open for enrollment during open enrollment, when all family members are enrolled in both Parts A and Part B. This has a $50 deductible, and then after, most services are paid at 100% after this deductible is met. There's no copayment for physicians or chiropractic visits. Inpatient services have no copays until your 91st day, and then you'll be paying 20%. For behavior and mental health, you do not pay anything if it is a Medicare provider. Otherwise, you're paying the 20%. Prescription drugs is under Navitus Health Solutions as well, and you can see the copayments there. Again, no eyeglass coverage. VSP should be considered. Your hearing aids and acupuncture, again, are not covered by Medicare, so you are subject to the 80-20 rule, up to 24 visits per calendar year for acupuncture, and your hearing aids are 2 hearing aids per 36 months. Your annual out-of-pocket is $1,050 for medical per member and $1,000 prescription per member. For telehealth is the same. Live health online, 24/7, $20 copayment, and again, worldwide coverage up to 6 months. If you stay longer than 6 months, UC Care or Core should be considered. So the health savings plan, as we previously reviewed, retirees are not enrolled in any parts of Medicare may stay enrolled in the health savings plan. However, once you become eligible, you must choose a different plan. Pre-tax deductions out of the pension payments are not an option. So retiree contributions are made directly to Health Equity on an after-tax basis, and they can take the tax break when filing federal taxes. I'm not a tax professional, so if you have more questions, please contact a tax professional. Once you become eligible for Medicare as a retiree, you must choose another plan. The health savings plan is not compatible with any parts of Medicare. If anyone in your family becomes eligible for Medicare, you must contact UC and enroll in a different UC-sponsored plan. You must stop contributing to the HSP the month Medicare coverage begins. The funds in your account will not be lost and can continue to be used for eligible expenses. A distribution can be taken at the age of 65 and will be taxed as normal income. It's your responsibility to ensure that you meet the requirements for HSP eligibility. UC will not know of your Medicare enrollment until you inform us. As stated in the previous slide, if you're enrolled in the health savings plan when you're retiring, you must choose any of the other UC Medicare plans from the list you see here. If all family members are enrolled in Medicare, another option is high option during open enrollment. So if you are in blue and gold and going into Medicare Choice, the UBIN 121 is the form that you should complete. From Kaiser Senior Advantage to from Kaiser non-Medicare to Kaiser Senior Advantage, UBIN 127. UC Care, Core, or High Option, you're going to be going into Core, UC Care, or High Option. You'll go into UC Medicare PPO or High Option. They both use the same form, the UBIN 123. VIA benefits for retirees living in a state outside of California. If you reside outside the state of California and all family members are enrolled in Medicare, your benefits will be administered through VIA benefits. VIA benefits is UC's Medicare Coordinator Program for retirees living outside the state of California. UC will provide an annual contribution for each covered family member under a health reimbursement account based on graduated eligibility. This amount ranges from $1,500 to $3,000. You may use these funds to pay for your medical premiums, prescription drug premiums, or even your Medicare premiums, along with other eligible expenses. Once you become eligible, you will be contacted by VIA benefits. If you need to make additional changes to things such as your dental, vision, or legal coverage, you must complete a UBIN 100 form. Plan premiums. So as an active employee, your premiums are based on your income or your pay band. Once you retire, your premiums are based on your service credit. Currently, UC shares the monthly cost of medical and dental coverage with eligible retirees up to a maximum UC contribution that varies each year depending on overall costs. Depending on which tier you fall under, retirees will be eligible for from 5 to 100% of UC's contribution to premiums, also known as graduated eligibility. So your premiums are based on your tier, the service credit years, what level of coverage you have, the plan you choose, and if it's a Medicare plan or a non-Medicare plan. Your years of service are based on whole years. For example, if you have 16.9 years of service credit, your premium will be based on 16 years of service. Here's an example of a retiree that's covering a spouse or child, and everyone is in UC Medicare PPO. The premium for this person would be $180.42 per month. This will be deducted from your pension check. As you can see, there is no Medicare Part B reimbursement for this plan. However, you can see both Kaiser and UC Medicare Choice there is a Medicare Part B reimbursement. So let's talk about the Part B reimbursement really quickly. Medicare Part B reimbursements may apply if your premium cost is $0. Part B reimbursement is based on Medicare Part B premium of $174.70 per person, and reimbursements vary and are added automatically to your monthly retirement payment. You pay the Medicare premiums we discussed directly to Medicare, Social Security, and then UC reimburses that to you on your pension. Note that the premiums that you see listed on this slide are based on 100% UC contribution or 20 plus years of service. On this next slide, this is the breakdown of the cost using the UC Davis Retiree Estimator tool available on UCNet. This tool can help you understand what your share of your retiree medical and dental premiums might look like. You can also scan the QR code seen here to access the premium estimator. We also give you the link to this from the HCF website at the end of the presentation. So let's review. This breakdown is based on a retiree with 20 years of service on the left versus 10 years of service on the right. So you have 100% UC contribution versus 50% UC contribution. And like the previous slide, this is for 2 adults. We're going to have 1 person on Medicare plus 1 person that's non-Medicare enrolled in the UC Care PPO plan. So the total premium for the coverage is $1,939.23. The max amount that UC will contribute is $602. Wait, sorry, that's not right. $1,336.39. The remaining balance is $602.84, which is the retiree portion to pay for their Medicare insurance. This is for the retiree with 100% UC contribution. As you can see on the right, the same plan combination with only 50%, the retiree will pay $1,271.03, which is double what the 100% person would contribute. It's significantly higher. So as they say, it pays to stay at UC. Now, this is a breakdown of a retiree covering a spouse or child, and everyone's in Medicare. MM means 2 adults, retiree plus Medicare eligible adult or child, both enrolled in Medicare. So the total premium price is $920.62. The max UC contribution is $740.20, which leaves a total of $180.42 for that person to pay out of their pension for the medical coverage. Now, if you add that $180.42 plus the 2 people enrolled, we're going to say that at the baseline for Medicare Part B, $174.70, the total this person will pay for their medical coverage would be $529.82 per month. We're going to review premium payments and how they're paid. So your Medicare premiums are either paid by you out of the Social Security income through Easy Pay Medicare, which is online, or quarterly billing where you can mail in your payment. Your UC premiums are deducted directly from your pension check. And then your Medicare Part B reimbursement, why it's green is because it's money coming back to you. That is a credit on your UC pension check. And it's only available for those with a 0 premium in the least expensive plans. Now, things to consider when choosing a plan. Check the drug formularies on the plan website to see if your drug is there and if prior authorization is needed. Match your priorities with what the plan is offering. If you need a specialist that is not in a provider network, are they available on another plan? Do a cost analysis on what your out-of-pocket expenses may be if you enroll in that plan. And always review the plan's evidence of coverage booklets that could be found on UCNet. Also, visit the HCF link page where you can read the fine print on the plans. You can also find recorded presentations and printed materials to assist you in the decision-making process. Now remember, just because you're retired is not a qualifying event. A qualifying event would be moving outside of the plan service area. So for instance, you are moving to Alaska and you need to enroll in a Medicare plan. That is considered a qualifying event. Newly eligible dependent, a new marriage or domestic partnership, involuntary loss of another group coverage. Say you're covered under a spouse and you all want to come under your retiree plan. That is a qualifying event. Or being enrolled in the health savings plan and enrolling in Medicare. Open enrollment is the opportunity to change plans if you don't experience any of the qualifying events. Open enrollment usually takes place in October, between October and November. So I have 2 very, very quick questions to help test your knowledge. So we have Barbara. She's turning 65 next month and wants to continue working for another 3 years at UC. Her coworker told her she needed to enroll in Medicare to avoid being penalized. What should Barbara do about Medicare? Should she, number 1, contact Social Security and enroll before her 65th birthday, or delay enrollment because she is enrolled under a UC-sponsored medical plan? And it is, she will be enrolled under her special enrollment period when she retires. If she is covering a spouse, her spouse will also have the SEP to enroll in Medicare. Now for a Medicare eligibility, you have Anna. She is 66 years old and ready to retire. She worked for UCSD and never paid into Social Security and does not have the 40 credits needed to qualify for Medicare. Her husband is 60 and he's already earned his 40 credits. What will happen when Anna applies for Medicare? Medicare will notify her that she does not qualify for Medicare because she did not pay into Social Security and does not have those 40 credits. And when should she reapply? She should reapply under her spouse's record when he turns 65. She won't receive a notification to reapply. So we say, put a note in your calendar when your spouse was going to turn 62 and reapply under his record. If she fails to get Part B under her spouse's record when she first becomes eligible, her monthly premium may go up 10% for each 12-month period. She could have been Part B. She could have had Part B, but didn't sign up. So it's imperative that if you are going to go under your spouse's record, you make note when that spouse turns 62 and apply under that spouse's record. I know I've covered a lot of information. I kind of went over my time a little bit for Q&A, but I'll stay on as long as possible. But here's some tools and resources that you may find helpful. So UCNet is the landing page for everything health and welfare related. Your open enrollment information will be there. Evidence of coverage booklets are there. Your UBIN forms are there. Medicare fact sheet is there. You can do a retiree plan comparison with the next link. You have quick reference guides, which you see Medicare and Medical plan is right for you. You have the fact sheets for eligibility for health benefits, CMS contact, Social Security contact, HICAP contact, via benefits contact, the RAS contact. We have Vanya's information and the UC Retirement Association, retiree link, email. You have the health benefits office. You have the San Diego campus benefits office. And then you have the healthcare facilitators, myself and Lilia. We do service certain employees, but we ask that you send a general email to the HCF help at ucsd.edu email with any questions. We do have Medicare resources as well. The RAS just started offering Medicare educational webinars and Q&A sessions. So we do have monthly webinars. Actually, the last one is tomorrow, but I believe they are going to continue to do those. This was just a test run. And then they have Q&A sessions every single week, and there is no end date for that. Then you have us, the healthcare facilitators. We do each month a presentation on health insurance after you retire. And then we have the help desk every second and fourth Thursday. So this, oh no, this is right. Every second and fourth Thursday. And then the link to the Understanding Medicare on UCNet. This will walk you through the process of Medicare enrollment. And now we are going to open it up for Q&A. And I thank you guys for listening to me ramble on. Hopefully you got the information you needed. You can unmute yourself or raise your hand